Hello, everyone, and thank you so much for joining us today. My name is Tong Lee, and I'll be facilitating today's webinar, How I Got Here, Career Stories from EMCRs. It is great to see such a strong turnout, and we really appreciate you taking the time to be here today. Before we begin, just a couple of quick notes. This session will run for about 1 hour, and we will have 3 speakers, each presenting for about 50 minutes, followed by a QA session at the end. Please feel free to drop questions into the QA function as we go. We'll come back to them later. I would like to begin by acknowledging the Aboriginal and Torres Strait Islander people as the custodians of the lands on which we meet today. I'm joining from Sydney, and I acknowledge the Gadigal people of the Eora Nation as the traditional owners of this land. I pay my respects to their elders, past and present. We especially take this time to recognize and honor Indigenous women who are here, as well as those who have gone before us. We look to their collective wisdom in guiding our work and seek continued partnership as we go together to improve health outcomes for all women living in this land. Today's session is about career journeys, real stories from female early and middle career researchers, not just the highlights, but the twists and turns, the uncertainties, and the decisions along the way. We are really fortunate to have 3 fantastic speakers with us today, each bringing a unique perspective and a career pathway. So without further ado, let's get started. It is my pleasure to introduce our first speaker, Dr. Zui Xiuqi, who is a health economics and a dietitian based at the Sydney School of Public Health, where she holds dual appointments at the Health Economics Lead, Sydney Health Partner Implementation Science Academy, and as a conjoint research fellow with Western Sydney Local Health District. And our second speaker, Dr. Brooke Nicol, who is an NHRC Emerging Leader Research Fellow at the University of Sydney, specializing in evidence-based healthcare communication across cancer, women's health, and social media. And our final speaker, Associate Professor Tess Ronalds, who holds an NHRC Emerging Leader Investigator Grant and a Robinson Fellowship, and is the Deputy Director of the ImageX Institute at the University of Sydney. I'll now hand it over to you, Sui.
Thank you, Tong, for the warm introduction, and thank you for having me here. So I actually participated in the WHRTN Leadership Program in 2025, and so it's a real pleasure to be invited back here and to talk about my career and to be part of, the 3 of us talking about very diverse careers as EMCRs in academia. So as Tong said, I'm currently the Health Economics Initiative Lead of Sydney Health Partners Implementation Science Academy. So Sydney Health Partners is an NHMRC funded research translation centre. We're one of 12 around the country, and we have a network of 5 local health districts, 10 medical research institutes, and a university where our mission is to support research translation into practice. Alongside my role here, I'm also a conjoint research fellow in health economics within Western Sydney Local Health District. So there I conduct and supervise health economics research and provide health economics capacity building for the health service. And my academic home is actually here within the Prevention Research Collaboration at the University of Sydney. I appreciate that my role is rather unique, and I'm often asked how I ended up here and how others can navigate career pivots. And so I'm going to share that experience today, the decisions that worked for me transitioning from dietitian to health economist, those that didn't work so well, and the principles that guide my decision making. So I'm going to rewind a little bit and actually start at the beginning and what I thought my career was going to look like and how that's shaped where I am today. So prior to health economics, my bachelor's degree was in nutrition and dietetics, during which time I kept myself really busy. I volunteered across a number of organisations like Nutrition Australia and the Cancer Council. You can see in the top left photo in here on this slide, I delivered Eat It to Beat It program, which was delivered in schools. And I also was involved in what we would now call a social prescribing model of care for day oncology units. On weekends, I was working as a diet aide in a private hospital. So that's the bottom left photo with us sharing cake. And here I collected and I collated paper-based menus. I worked in the kitchens and on tray lines, and eventually supported the transition of the paper to electronic menu system. During that time, I was also a personal trainer and an accredited strength and conditioning coach. in an Anytime Fitness for about 3 years. And there I ran women's strength and conditioning training programs. I designed small group sessions teaching women to exercise. And over the space of, say, 10 weeks, we'd achieve strength and, aerobic kind of goals. And instead of weight or aesthetic-based goals, the programs were all about teaching women to be strong and to define their own version of success when it comes to exercise. I loved this. I loved all of it. I had beautiful clients who you can see in the photos. One of them made me a cape. That's the top right photo. We had singlets, boot camps, nutrition sessions, challenges, all of that fitness stuff. I'm talking over 10 years ago before it became, a really big thing on Instagram and social media now. I loved it. I really thought I was going to be a dietitian and a strength coach. I was going to own my own gym. I was going to work with patients and athletes. But, quite clearly, that's not where I ended up. So there were some really defining experiences for me that led me away from that path. And the first was that in the final year of my degree, I had to go on 19 weeks of unpaid placement, the majority of which was outside my hometown. So I had to shut down my business. I went on prac and I continued working in the private hospital on weekends. And I think during my placement and also my new grad dietetics experience, there was a lot of experiences that were the catalyst for my transition to health economics. I remember cardiac patients, in a private hospital getting angry with me because I couldn't give them alcohol with their meals. I remember working with an eating disorder client in a local health district that didn't have an eating disorder service. So they were treated by a gastrosurgeon on the ward, on a general ward. They were strapped into a bed and had an NG tube forced upon them, and eventually they ripped it out and ran away. I also had an older male patient who had been flown in from remote New South Wales. He was a farmer and he'd kicked his toe a few months earlier, but he didn't know that he actually had uncontrolled diabetes and undiagnosed diabetes. So that kicked toe turned gangrenous, and then that foot became gangrenous. And months later, it became an above the knee amputation and he lost his ability to work. He was the sole income for his family. His wife was in deep shock. And as a young dietitian, I was told to provide him education for counting carbohydrate exchanges. And I just couldn't understand in that moment, why we couldn't prevent and give better care to patients and prevent some of these outcomes. As a dietitian, I also saw, children from really disadvantaged backgrounds, like young kids with severe obesity who were being packed, 14 discretionary items in their lunch boxes. I could really go on, but this whole experience changed my perspective and it made me really interested in governance and investment decision making in healthcare. I wanted to advocate for health promotion and prevention in the language of decision makers, and that's economics. And this has really been the guiding purpose and the principle behind my career decisions ever since. So at the end of my dietetics degree, this transition, I had a mentor, a dietitian named Annette, and she suggested I looked into health economics. Prior to her, I'd actually never heard of the discipline. And given I did general maths in high school and I had to work so hard to even get through undergrad statistics, I was really uncertain that I could survive, I could thrive or make a career in a field that was grounded in maths and stats. But I knew I didn't want to practice dietetics, and that required me to pursue further study. So dabbling in short courses wasn't going to be enough. And so I looked up all the master's programs in Australia. And ultimately, my choice of the master's program at the University of Newcastle was pragmatic. The Masters of Health Economics anywhere else was going to cost me about 30 grand a year, money I didn't have, and it wasn't a Commonwealth supported place. But at the time, the Masters of Research program at Newcastle provided scholarship for coursework in exchange for completing a substantive research project. I wasn't yet an economist, but access to tertiary education in biostats, epi, health systems, health economics, health financing in exchange for a research project sounded like a great deal. And so in this project, I ended up recruiting 1,119 participants from an antenatal outpatient clinic over the space of 10 months. And this success was actually, the catalyst for my upgrade to a PhD. I didn't plan on doing the PhD, but it happened. And that data has since been used for multiple PhD projects since. During that time, my mentor also put me in touch with the Director of Health Economics at the Hunter Medical Research Institute, who was fortuitously seeking health economics interns. I applied and was selected, and following the internship, I was hired as a research assistant and then worked there for just shy of 6 years. The HMRI Health Research Economics team works alongside the Hunter New England Local Health District, the University of Newcastle, and Regional Health Partners as a part consultancy, part academic team. Through this opportunity, I was exposed to a wide variety of projects, methods, and stakeholders. And I discovered that despite my reservations about my quantitative skills, I actually really enjoyed the research and the data analysis and working across really diverse projects. So after finishing my PhD, my husband and I wanted to move back to Sydney. I grew up here, and we always wanted to come back. And so I took a role as a manager in a health economics and social policy team in a Big Four consulting firm. Now, it quickly became clear to me that this wasn't the right fit. I was entirely off the tools and I wasn't doing any research or analysis, and I was actually earning less than a level A academic. So I left within a year. When I announced that I was leaving, I heard all of these really familiar warnings, like, it doesn't look good on your CV to have short stints. You need to stick it out. You've got to stay for at least 2 years or whatever time period people thought was appropriate. But here's something that this experience taught me. And that is that not every role or workplace is going to be right for you. And it's okay to leave, even if it's only after a short period of time. And this comes up often in my mentoring conversations. So I really want to say it plainly, is that saying no to something that doesn't feel right for you, even if it looks really good on paper, is just opening the door to something that is right for you. Now, I'm not suggesting, you burn bridges or you do anything like that. But as EMCRs, we all have really diverse transferable skills with real options across sectors outside of academia, most importantly, access to roles and diverse career paths. So I think one of my big lessons from this experience was really don't make career decisions based on how they look on a CV. Base them on what you want for your life. And that's been another really big guiding principle for me. So after leaving the consulting firm, I transitioned to a level A postdoc research role in public health at the University of Sydney. It was a bit of a gamble, to be honest, because it wasn't actually a health economics position, but I was drawn to it because the project and the team aligned closely with my public health background. The role involved realist and pragmatic evaluation, collaborative work across a wide range of teams, and a really rigorous applied research field that interested me. Fortunately, it really worked out because almost 3 years later, I still call the prevention research collaboration my academic home. A key part of my success, I think, throughout my career has been having good mentors, sponsors, and leaders, and these people having them in my corner. And I was really fortunate, I feel, when I started my first postdoc role here. The PRC director, Professor P.H. Pongsavan, hired me and really fosters an environment of trust and freedom. And this really works well for me as someone who likes to keep busy. So in addition to my core research projects as a postdoc, she really encouraged me to network widely, to join projects and teams that interested me, and to continue developing my technical skills. We've had many honest conversations about the competitiveness of my academic track record and the fact that I will not get a look in for an investigator grant. That's just not the path for me. But PH's philosophy has always been to play to my unique strengths and to not lose sight of my purpose. And that really seems to be working. I will say that on the flip side, one lesson I need to remind myself often is that comparison is the thief of joy. Academia is a highly competitive field, and when you're critically appraising your own track record and whether or not it's worth your time and the opportunity cost of applying for a grant, I often have to remind myself that, for me, the classic academic fellowship path won't be the one that I follow, but that really gives me the opportunity to carve my own path and find new ways of working, which leads me to my current roles. So how am I personally carving out my career in academia? In 2024, I applied for the Sydney Health Partners Health Economics lead position, and I dropped to part-time for the final months of my existing postdoc role. In this role, I provided health economics support through advising, I do provide health economics support through advising or supporting on grants, supervising students, providing capacity building. And like most health economists, there is more demand than I have capacity to deliver on. So I've established a network of health economics fellows who build capacity across our network partners. It's also a great opportunity for development and exposure amongst other EMCR health economists. Late last year, as my first postdoc contract was running to an end, an opportunity arose to join Western Sydney Local Health District as a conjoint academic health economist. In this role, I work with the district on projects that have been identified as a priority by their leadership. I build capacity in health economics, and I also lead my own research, but that all aligns with the district's priorities. It's been, over 10 years since I've transitioned from dietitian and strength coach to health economist, and I am absolutely certain there are faster ways of doing it. But career pivots are hard, especially when you have to juggle competing priorities, career responsibilities, or simply living your life. But I would say that for anyone considering a pivot, it will be slow and there will be challenges that make you question why you did this in the first place. But I don't know, I think in light of recent news and what's going on in the world, the retirement age keeps increasing, the price of property keeps increasing. We're all going to be working for such a long time. If you are considering a pivot, no matter how big or scary it sounds, I really believe we have plenty of opportunity. I'm not able, there we go. So finally, my lessons learned. Academia is a challenging and competitive sector, but it's no different from any other competitive industry-leading sector that's constantly trying to improve and grow. However, in academia, the intellectual freedom and the opportunity to do fulfilling work that aligns with my values is a privilege that I'm really personally grateful for, and so I try to make the most out of every opportunity. Not unlike my strength program for women, where we set our own definition of success, I'd like to define what success means for me in my career, not academic metrics, but for me personally. And I really want to know that the work that I'm doing is having a real world sustained impact for patients and the community. Career success doesn't happen in psychologically unsafe environments where information, support, and opportunities aren't shared freely and equally. So surround yourself with people who you can work with. Not necessarily friends, not, teams that call themselves families. Work with people with similar values, with similar, who want to work with the willing and network widely. I'd also say that it's easier to give positive feedback. Uncomfortable feedback is really hard to deliver. And so if someone cares enough to give you honest, uncomfortable feedback, or you trust someone enough to ask, listen well, because it's often more helpful than comfortable feedback. Finally, there's so much diversity in academia and academic career paths. Mine is just one version. When it gets overwhelming, I remind myself that I did ask for this. I wanted an exciting academic career with opportunities, and so be careful what you wish for. Finally, I will add that health economics is a really in-demand field, and there's no shortage of work across academia, government, pharma, consulting, and the not-for-profit space. So I encourage anyone who enjoys research and quantitative methods and is considering expanding their scope of practice to consider health economics. It's a diverse and interesting field that spans policy to highly technical analytic work, all with real-world impact. So if you have questions, please reach out. I'm happy to chat about it. Thank you so much for your time. I've given up. The remote, Tong, if you want to take over, thank you.
Thank you so much, Zoe, for sharing your journey. And or just next up, our next speaker is Dr. Brooke Nicol. I'll hand it over to you, Brooke.
Great, thanks. Everyone can see my slides and hear me all right?
Yes. Yes.
Yep, great, thanks. So yes, thank you so much for inviting me to speak and great talk, Zoe. I think lots of the things I will say will resonate, but also be quite different as well, given everyone has such a different pathway. So I too, just before I begin, would like to acknowledge the beautiful country on which I'm zooming in from today and where a lot of my time and my work has been conducted over the past decade. The Camaragal and the Gadigal people of the Eora Nation, and pay my respects to elders past and present, and extend those respects to any Aboriginal or Torres Strait Islander people on the call today. So I guess I'm just going to start off here by showing you this kind of rough timeline of some of the major highlights and interesting things that have happened across my career path. I won't go through them all in detail, but I guess I'll just begin to say that I started as an undergrad honors student in science, and I really had I had no ambition or motivation to ever do a PhD. So it just kind of fell into my lap. I'm sure that's a similar case for other people, but I did start in science. I did a undergrad bachelor's degree in biology and physiotherapy, and I always thought I would be a physiotherapist. I'm from Canada, if you can't hear the accent. And in Canada, you have to do a master's of physiotherapy. So before I did that, I did a lot of traveling and backpacking with friends around the world. And I really developed this passion for public health. And I really also developed a passion for travel and adventure. And so I just thought, I'm not ready to, go into it and start a career. And I applied for a scholarship, which brought me here to Australia to the University of Sydney to undertake my Master's of Public Health, which I did. After that, I got hired as a research assistant with a team in the School of Public Health, which were really focused on health communication and evidence-based decision making. And I really developed kind of a strong interest and passion for that, seeing, how we can communicate information to a population that's understandable and accessible to everyone so that they can make informed decisions about their health. And during the few years I did that role, my lovely supervisor, put the hard sell on me. Well, you're doing this research anyway. Why wouldn't you get a PhD out of it? I've heard that story now many times since, but no one told me it before. And so I embarked on my PhD in 2015. I began kind of mid 2015, mid to late 2015. And I spent 3 years focused on a topic I'll tell you a little bit about in a second, but it was a public health topic related to cancer. Over that time, I published many papers. I submitted and was awarded my PhD. And within a week, I was on maternity leave with my first baby. So it was not the normal transition from, being a PhD student to a postdoc, which I've heard is extremely difficult, regardless of having a newborn. So I was off for about a year, and then I came back and was hired as a postdoc level B with my same supervisor and team. And I felt very lucky to have kind of a year of funding. And in that time, I was, frantically writing fellowships, and really lucky enough to be awarded one in kind of the following year's round, which was an NHMRC EL1 fellowship. But before starting that, I had another baby, so I was off for another year. And then I came back and I really started that fellowship and have been on it for the last 5 years. It runs out at the end of this year. And I was promoted to level C, and I've had a couple major kind of important highlights in terms of getting big awards, having major public trials published, and securing a bit of other funding and grant success with my wonderful team. Now, as I mentioned before, my PhD was completely opportunistic. I did not come in with a burning passion to do a PhD at all, nor did I have an idea of what I wanted to do it on or what I really wanted to, have this passion to focus on. But overall, I was really interested in the aims of the research that I was doing as part of being a research assistant. And that was really this idea of reducing overdiagnosis and overtreatment, particularly in cancer screening, but kind of low value care across the health system, using kind of communication and evidence. Like I said, I had no kind of strong passion for the specific topic area where I landed, which was mostly focused on thyroid cancer, although I looked at a few other different cancers in the time. But I knew it was relevant. I knew it was such an important topic and field to be in. And like probably most people on this call, my family had been touched by cancer as well. I really made sure that I was focusing on methods during that time that I was really interested in and that I was strongest in. I avoided health economics completely because I knew I would probably crash and burn. But I guess the main thing that I was really, really pleased about and felt really, really lucky to be part of is a really supportive research group and having a really supportive research supervisor and team around me during that time. And since that really kind of distinct, 3-year period of where you kind of know that what you have to do, you have got a plan from the beginning, I just really feel like this, that I'm like literally sitting on this wave and I'm really not sure what's going to come next, but I'm really trying to ride the wave, enjoy my time in academia, and, just really take every opportunity as I can and see what happens. I often tell my colleagues or my students or staff that I enjoy it now a lot. I love my job. I wake up every day excited to go to work and meet with my team and do what I do. And so I'm just going to ride this wave until it crashes. And it may well do. And I will explain why soon. So I guess, yes, I was awarded that an EL1 investigator grant. And as Zoe alluded to, those are um, super competitive grants. And I am quite aware of that. And as a research focused academic, I don't have security. So if I don't bring in the funding, then I don't have kind of a career to fall back on. So like I said, I'm keeping going, but always kind of trying to keep the bigger picture in mind, that the skills that I've learned and the work that I've done will be completely translatable into other sectors or in other ways if for some reason I can't secure further funding. I've always tried to do, work on projects that align with my interests since my PhD, and now more so that personally interests me, actually. I've taken up leadership and teaching opportunities that I was interested in and had time for. And I've always tried to be clear about the goals and my vision long term. And that can really be easier said than done. But I do try and keep what I'm doing and why I'm doing it in front of mine. And really, the main reason for that is for the people that I am doing it for. I think we all are in this field to have impact on the people's lives, and for me particularly the public health of individuals in Australia and worldwide. And so, really trying to keep that. I've always really tried to keep that in mind. I've also tried to make sure my research was policy and practice relevant, things that are timely, that are important. Again, things that definitely interest me, but that we know that the government wants to put money into, and that people are really kind of trying to push forward so that it can have a bigger impact. And I've always tried to work closely with consumers, relevant stakeholders, and also tried to communicate my message to the public through various media outlets. And that's become kind of more of a passion for me, actually, as the years have went on. So these are just some examples of some of the policy documents that my work has been cited in over the years. And again, just, really, I've always really tried to think about how the work can be impactful from the get-go. And I think that's important to keep in mind. And these are some of the media stories that I have provided comment for, or that my research has been covered in. And I feel really, really lucky to have been able to engage with some of the major studies that I've led over the years. And doing all that media is actually completely time draining, and it's nerve-wracking. A colleague of mine described it as jumping out of an airplane. It's so exciting, but it's so scary at the same time to put yourself out there and do those things. But again, I really think that I have tried to keep the reason I'm doing what I do at the forefront of my mind. And one of the reasons is, I think, that we need to be able to do the good research, but also disseminate it and get the messages of what we're doing to the public, to the people that it's really impacting. And so as part of that, like I showed you, I've been a part of a lot of media, but I also think that it's earned me some quite nice awards too, for kind of going above and beyond the kind of day to day. And that has been really lovely and nice to be acknowledged for. I've also very recently been part of a social media campaign, which has been backed by the University of Sydney, where we've created evidence-based posts. And we put that out there. And again, this is totally out of my comfort zone. I think it might be my first and last time ever being an influencer, but it's been such a fun experience to be a part of, and I've learned so much along the way. And again, I think I'm just really trying to allude to the fact that research does not have to sit in a silo in your lab or at your desk in front of your computer. You can do a lot of fun things and go beyond kind of those academic silos with the work that you do. I also just want to acknowledge that the areas that I have worked in have also tended to be a little bit controversial at times, and haven't always been in line with the popular narrative. And I've had some pushback on my work from consumer organizations, from corporations, from various individuals. And it honestly has been really hard personally, especially when consumer organizations have kind of made statements about your research, because for me, that is really who I'm doing the work for. And the real reason that I do it is to, provide the best evidence so that we can make policy and practice relevant decisions that give the best outcomes for patients and for the public. Um, but again, putting yourself out there, sometimes you do get this kind of backlash. And personally, it has been hard to navigate, but I do try to keep the bigger picture of that in mind. Now I'm just coming back quickly to this little diagram that I showed timeline at the beginning, and just really wanted to say that, amongst all those kind of great successes and achievements and milestones in my career, I have had, and those X's, I just kind of got sick and tired of copying and pasting them, to be honest. But they are, they are so sporadic in academia. And like Zoe said, you can't compare yourself to other people. You've got to run your own race. And you do have to be really comfortable to sit in rejection, because for every kind of one thing you put forward, I do really think you get 10 or more rejections back. So it's just, something that I always try to remind myself that I'm not the only one here too. And this is sometimes how I feel about all those rejections, being a full-time working mom of two. But I do think that the benefits of it all really do outweigh any downsides. And if you do have the bigger picture in mind, you can bounce out of bed quickly in the morning. So my top tips is really, like Zoe said, is really don't rule out any career opportunity. I think if you have something that feels right at the time, an opportunity, I think you need to go for it. I don't think you should pigeonhole yourself as a researcher or in your career. Find your niche. Definitely find what you're good at, what works for you, what makes you happy. But really see the bigger value of what you do and be clear about who you are and what you want to achieve. I think that's really important. Keep a good record of everything you do. If you're writing promotion applications, fellowship applications, your CV to transfer to another field, we do so much in our day-to-day that I think, because the standards are so high, we just think like, oh yeah, I just did that because that's what I'm expected to do or what I should be doing. But what you're doing is like actually amazing and important. And even the little things I think are important to keep a good track record of. Say yes to do things that serve your interests and fulfill you as much as you possibly can. I do think saying no, and I've got better at doing that, is such an important skill to have. But really, try to understand what is going to kind of build you up or build your track record. And it takes a while to kind of try and understand that, I think, too. Maximize your time. I think that's goes hand in hand with the point before. Talk yourself up as much as you can. Imposter syndrome is totally real. But in this field, I think you have to try to embrace it as much as you can. I think everyone feels that way. I know when I write applications, I definitely cringe a little bit when I have to say certain things about my track record. But I think, like I said before, don't downplay your skills and what you do. Aim high. I think the worst thing that's going to happen is you're going to get rejected. Send emails to people. You never know, they might respond. If you need help with things or want opportunities, submit to those big journals. You never know when it might stick. And you really never know. I think about quality over quantity. That's something, again, that I've learned, especially in terms of publishing and taking up opportunities. It goes kind of with that, do things that serve you, but also, really thinking about impact and the importance rather than just doing a lot, I think is a good thing to remember. Enjoy the ride. There are definitely highs, but there are a lot of lows as well. They'll definitely both come, but I think you just got to enjoy it all. And like Zoe said, it's probably not different outside of any career. And this one is super, I think, important to me, is to work with fun, clever, and supportive people who bring you up. I think, you've got to be part of a bigger team. And I think it's so important to make your job and your career enjoyable. And just lastly, I guess my 11th point before I finish up is just to have fun and make time for life outside it all. For me, that's my family, and spending time with them. But I just think you work is one part of your life. It's definitely an important part, but really having a life outside of it all as well is so important. Thanks so much. And happy to take questions after Tess speaks.
Thank you very much again, Brooke. That was very insightful. Now I'll hand it over to our final speaker, Associate Professor Tess Jonas.
But thank you again to Tom for inviting me to speak. And it's so wonderful to hear so many good stories from other Brooke and Zoe on how everyone got here. Because I think, again, it really highlights that everyone's journey is so different, and just to embrace that. So hopefully this will be another completely different one that people don't really expect coming. So I think two really key things about me growing up that sort of set me apart. Well, maybe the first one's not so much in terms of, I think, a lot of people, one of my main goals was to be an Olympian. I really wanted to go to the Olympics. Sport has been such a big part of my entire life. And so as most kids, I grew up, okay, I'm going to be an Olympian and represent Australia. But then the second one that maybe is a little bit left of centre is I also always wanted to be a physicist. And so, I don't think there was that many kids like me that I'd come in from school playing sport, sneak into my brother's room, steal one of his physics textbooks because he was a few years older than me, and try to do some problems. So let's see how I went on. Did I reach my life goals from when I was a child? So I was successful in becoming a physicist, if the slides are going to behave for me. But strangely enough, this is, a medical research chat. So how did I make it from, wanting to be a physicist, so working in the biomedical research field? We'll get to that in a sec, but I just wanted to highlight, I love my work. I'm very passionate about it. And I think a theme that's been throughout these talks is about having fun. So whenever I am out experimenting, whether it be locally here in Sydney or internationally, I always do it with a smile on my face. Unfortunately, two of those pictures have masks in there, but there's a big smile underneath. I take my work very seriously. I don't take myself too seriously when we're doing this, because it's a really hard career. There's a lot of hours and competitive, time spent. So you got to have fun with some good people along the way. Another thing that I really am passionate about is travel and sport. And so I like to combine, and I've been able to leverage a lot of my career to do a lot of the travel that I wanted to do, so I can go and watch and tick things off my sports bucket list. But I think these things go hand in hand in terms of, an academic career does give you a lot of freedom and a lot of chances to travel and interact with really cool people. And so you may as well also have a good time while you're doing that. And then I didn't quite reach my goal of being an Olympian. I was fortunate enough to play professional field hockey in Belgium. And then after I sustained an injury there, I decided, great, I will be a physicist. So I did my PhD. But in that time during my PhD, I took up ice hockey. And then I've been fortunate enough to represent Australia at 4 World Championships. And I always bring up the sports stuff, one, because it's always a good talking point. It's a really good icebreaker at conferences and networking things. But so many of the things that I learned from when I was an elite athlete have definitely translated over into an academic career, in terms of just how competitive it is, how persistent it is, like time management, working as a team, all those things. So it's really, been a strength that I've seen play out for my academic career. But in terms of my academic career, let's have a little bit of a context. So I'm originally from Adelaide, and it is really kind of strange that now when I give this presentation, I should probably update that logo, because the University of Adelaide doesn't exist anymore. It is now Adelaide University, but this is the campus there in Adelaide. It's a really beautiful spot if you haven't been down there. But I started there and I wanted to be an astrophysicist. So I did a Bachelor of Science, majoring in astrophysics, and thought I'd just spend my days staring at the stars, answering the big questions of the universe. But turns out if you want a job, that's a little bit more difficult. I mean, I think space is back into a popular sort of, mind frame these days, but it wasn't so much back in the late 2000s. So I still did my honours there, but I did take a gap year to go play my field hockey professionally in Belgium. And that was definitely a first for the physics department when I approached them to be like, hey, look, I really want to stop my project. I've got this opportunity to go overseas and play. And, their biggest concern was that I'd get an extra year to work on my projects. And I had to convince them that absolutely not. I will not be thinking about my physics while I'm over there. But as I said, it was a real defining moment that I got injured. I wasn't able to play field hockey anymore, but I really solidified then, great, I'm going to chase my physics and physicist dream. But then I did pivot during my PhD. I went from looking at sort of really big, really large galaxies down to really small things called whispering gallery modes, sort of staring into a microscope most days. And even though I really wanted to do that in terms of I reached my career peak of being a physicist, like getting my PhD. I'm always very honest with anyone that I chat to about careers, is that then by the end of my PhD, I swore off research. I was like, absolutely not. This is not the career for me. I can't do this. I don't want to do this. There's just nothing about it that excited me. So I took a complete 6 months off. I submitted, went on a nice holiday, came back in Adelaide, just hung out for a little bit. It didn't really do too much productive, but that 6 months time really gave me a lot of time to reflect. And I sort of think I worked out that actually, well, either maybe one, I really needed a job, and two, that actually research was something that was passionate for me, but maybe I was just in the wrong field. So I'd learned all of these amazing skills as both a theoretical and an experimental physicist, but the thought of standing in a laser lab with, no outside light for days on end didn't seem too exciting. But turns out I did want that, because I've pivoted to X-ray imaging, where also you don't have windows and outside light in your apparatus. So then I took a postdoc at the University of Sydney, where I am still today. And I'm always very thankful for the opportunity that I was given to land this postdoc, in terms of, it was a completely different field. I didn't know anything about medical physics, which is where I ended up. And so the ImageX Institute did take a bit of a gamble on me coming in there, to have someone who doesn't have sort of any expertise in that, only knew things from small parts that I'd done in undergrad. But then in the now 8.5 years since I made that transition, I actually worked my way up to being the deputy director of the Institute, which is very fantastic. I have had career success in securing fellowships, so I'm lucky enough, and especially with the scores this year, super thankful that I was able to secure mine last year from the NHMRC. I also have a Robertson Fellowship from the University of Sydney that, again, has very fortunately given me a underlying continuing position at the university, which is obviously very difficult to come by these days. I've been very successful in both individually and as part of teams to bring in funding to sustain my career to date. And then I've also been the recipient of some key prizes. Now, I sort of, put all this here because that looks all fantastic on paper, but hopefully in the next sort of few minutes, we can go through some of like the key decisions and thought processes into trying to translate, that into the, what I did to translate into success to have these outcomes. Because again, sometimes it's nice to reflect, but it's also, it makes it look super easy when it's just up there on the slide and there's sort of nothing else of the context behind of how we got there. So there's sort of been 4 like really key areas that I think have been pivotal to success and decision-making along the way. And the first one for me is collaborations. So again, I just, pulling from my sports days, teamwork makes the dream work. Like academia is a really funny one, in terms of you obviously have to be extremely talented and driven and individually have success to drive research projects. But then nothing is getting done in isolation. Like that doesn't even make any sense in terms of, we're trying to solve really massive, impactful problems that affect large populations. Not one person is going to be able to do that alone. So it's, collaborating and building teams is really important. And, for me, one of the biggest ones was started with my industry partnership with Siemens. So when I first joined the University of Sydney, we'd just been lucky enough in our group to win a massive grant that installed a research dedicated hybrid theatre, one of a kind, where Siemens was giving us this specialised access to the system. And I got fortunate that sort of from day one, I got handed the keys to be like, great, you're in charge of this collaboration. And there was a lot of challenges in that, in terms of, one, learning how to speak with industry partners, like, their priorities and goals and KPIs are slightly different to what we have in academia. And also, at that time, there was a little skepticism about, University of Sydney being chosen as the site for this amazing, research spot to be placed. And so again, a lot of those first few years were building trust with that team, so delivering on projects, showing that we were the good partner to have. This was a good reason for all that equipment to be here. And now over the years, they're handing me projects to do and things like that. And so it's been really nice to see that evolution. And then, one of the things I love about this job is being able to work with other people and draw on expertise from different fields and around the world. So, I've really built up a big, strong academic and clinical base, because again, we always want to be translating, any advances that we're making into that clinic and seeing the impact on the patients. So being able to build teams and get out there and meet new people has been a really key and fundamental part to my career success. So that sort of leads into networking, because you can't really build teams unless you are getting your name out there, you're getting out there yourself, people know who you are. And so, again, I think there's so many tips to how you can do networking. What's been really successful to me is doing, research visits and asking to come give talks and being invited to give talks around conferences. So just the nature of my work, I tend to have a lot of collaborators in North America. And so, from the very first time that I joined ImageX, anytime I was going to a conference, I would look, okay, where's that conference going to be? What are the groups around or within a couple states nearby that I could either just extend my conference trip 1 or 2 days, get out there, meet new people, give talks, visit labs. And then so that grew from me initially initiating that, and then having, other groups then, in recent years, they know that I'm going to be at that conference. Great. Can you swing by this lab? Can you see our facilities and all that? And so again, not every one of these, something has come off, but a lot of the time, it's someone else who's sitting in that seminar room, they, maybe have never heard of you. They hear you talk. Oh, great. There's now a collaboration. There's a pathway to success in implementation. Additionally, I find that obviously you need funding to be able to do sort of a lot of this stuff. But when you're applying for travel funding, being able to say, I'm going to go visit these people, I'm going to give talks here, that also can strengthen your application and separate you from others who are applying for that same funding. So that's definitely been a big success for myself, is to build those collaborations and get out and give these talks. And then obviously that helps build your track record too. Another really thing that shaped my career that I was really naive coming into was prizes. So I've been very fortunate that I was the recipient of a Eureka Prize just a couple of years ago. But, it was definitely a bit of mystery to me about how that all happened initially, in terms of it took me about a year to work out who had actually nominated me for the prize. But I also was naive to think that, hey, just as you're going in your career, you would just get rewarded. If you do good work, you'll get a prize. But unfortunately, no, that's not how it works. Someone has to nominate you. You can nominate yourself. Don't be scared to do that. Really putting yourself out there and going up for these prizes, can be career changing. And, a lot of the time is just, you don't know that those opportunities exist. And so then you can start thinking about, okay, what is about my work that's unique, my story, my success, that is going to put you in a position to be successful in prizes. And then additionally, again, you've really got to find, you have so many different writing voices, which was something that I absolutely didn't think of coming in as someone who just wanted to be a physicist. I sort of neglected English in high school, but, you've got your paper writing voice, your grant writing voice, and your prize writing voice. And, learning to build those skills as you're going as well is going to be really important for your career, and it was really pivotal to mine. I feel like I've now lost all of that shame, and I can just shamelessly write about myself in any situation. But it's also good to have a reality check that that's, not how we should talk about ourselves in normal conversations. And then the final one is obviously, being, research focused academics, you live and die by the grants, and that it is a really difficult and challenging process. And there has been, pivotal moments throughout my career there. But one of the things that has served me the best is definitely trying to have some sort of plan. Be flexible with the plan, but have a plan of where you're going, because a lot of these things, especially fellowships, it's, you've got to be building for 2 or 3 years in advance to then, be at a place that you can be successful. So, either something that I always got told growing up, was especially playing sport, was, there's no such thing as luck, there's only hard work. I think this sort of applies to grant as well. But in saying that, you've got to be good to be lucky. And so, again, I think we can have plenty of conversations around how grants are awarded and scored and funded. And, I guess, there is a little bit of luck at that top, but you want to be putting yourself in that top sort of 10 to 15% echelon to then be lucky to get some of these massive grants, because what is separating at the top is very little. But if you can get yourself sort of above that average, then you're in a chance to be lucky. I think everyone wants to be able to be successful. Can everyone be successful? That's a really hard conversation to have. And there's a little bit of discussion about challenging conversations. But again, it's like trying to put yourself into the position to be as successful as you can. So that's, planning out securing all the little things. Are you getting your little talks along the way? Are you picking up your prizes? Are you collaborating internationally with other people? You can start to build your way to being more successful. But hopefully some people are young, old enough on this call to know that there's no crying in baseball, but there definitely is in research. And I'm also the first person to say that I wear my career on my sleeve. So for every success, I love it. I'm super excited. I want to share that, but I equally feel every single rejection, but it just fuels me. I just want to prove people wrong. I want to tell the NHMRC, well, no, you should be funding me. I am as amazing as I can be. And so just as a quick summary, so I was, I've probably had the most success at UCID internal grants. So I started on a fellowship. It took me 3 years to convince the Cancer Institute New South Wales that my research and my career was worth funding. In the meantime, I went and got a Robertson Fellowship, so that bought me a little bit more time. But it took me 6 attempts to get my NHMRC Emerging Leadership Fellowship. In fact, I aged out of EL1 and got success in EL2. So in terms of, there's definitely a lot of tiers of rejection and that along the way, and plus the countless of other grants that I didn't get. So I'm aware of the time. So just a few key takeaways. Nothing still underpins that you've got to deliver in your projects and you've got to get things done. So there's there's so much you have to juggle as an academic, but nothing takes away from doing amazing research, which I'm sure everyone is doing. Networking is really key. You got to put yourself and your work out there. Again, there's so many, there's so much competition out there. What can make you, stand out from the crowd? Definitely be strategic, have a plan, have that longer term vision, but be open to being flexible about it. And definitely get people in your corner. Who's going to nominate you for a prize that you don't even know exists? Who's going to give you that mentorship? Who's going to give you that sponsorship? And then just lastly, definitely be you, own your career path. Everyone has something to give, and everyone's story is unique and important. So thank you very much.
Oh, thank you. Thank you, Tess. Well, thank you so much, everyone, to all three of you, to our fantastic speakers for those engaging and honest reflections. That was awesome. We will now move into our Q&A session. We already got some great questions coming through. I'll start with those, but please feel free to add any further questions as we go. And I believe the first few were for you, Zoe. And one of which is from Hannah, saying, Zoe, I'm interested to know what factors indicated to you and your mentors that an investigator grant pathways wasn't for you. Thanks for sharing your interesting story.
Thanks, Tong, and thanks, Hannah. Such a great question. I think that with any grant application, there are internal and external factors which drive your opportunity or your probability of success. I think external factors that impact me for investigator grant is, I don't know if you've seen the news, but health services research, which is my area, is like 2 or 3% success in investigator grants. It's such an issue that our, national bodies are taking it to the NHMRC and saying, why are we getting only 2 and 3% of all the total collective fellowships? And so that's completely out of my control. That's just, I think sometimes so much of grant success is about looking at the environment and going, actually, I'm an economist. There's too much opportunity cost here. It's not worth my time in applying because I do health services research. Think of health economists like you think of statisticians as well. Like I plug into other people's projects. I'm really interested in methods, but methods aren't sexy. People don't want to fund new economic methods to evaluate the efficiency of things. But the government is also like, hang on, we really need this kind of research. So for me, there's those external factors. But internally, I think that's, I wrote my best CV. I put everything on there. I, put on Tess's, sell yourself voice. And then I swallowed my pride and I handed it to people that I trusted. And then they, very supportively tore shreds off it. I didn't have enough publications. I didn't have enough, a lot of my work is actually for health services. So it's all internal reporting. A lot of the work that I do as an economist is like, actually, we can't afford this and it's not efficient. So that work doesn't get published. And so my publication track record isn't strong enough. The grants are there, but not enough AI to be competitive with the likes of Brooke and Tess, who are so competitive. And so part of it was going, actually, all of our time is so precious. exactly what Tess and Brooke were saying. There is a strategy for me to become successful for investigator grants, but I'm not there yet. So what am I doing? I need publications, first author. I need some commentary pieces, which establish me as a leader in my field. I need bigger collaborations. I collaborate internationally a lot, but I need more runs on the board for those collaborations, and then taking my time and striking when it's right. But that's my rationale. I think also I don't know, I never apply for prizes. It makes me deeply uncomfortable. Tess, you're going to have to give me a lesson. So I need to do stuff like that, and put on my big girl pants so that I can be eligible. But it's all part of the strategy. It's just a matter of time.
Well, thank you so much. So I echo you, totally can how you feel. So it's always so challenging to apply for the EOIU to the investigator grants. Well, and there is one follow-up questions saying what are some of the red and green flags to look out for in a role?
Sorry, what was that question? What are some of
The question was, what are some of the red and green flags to look out for in a role?
In a
In a
red
role,
and green
yeah,
in a
in a
room?
role. No, in a role, in a job role.
Oh, in a
that we
role,
should,
red
yeah.
and green flags. Oh, like I think we all need to listen to our intuition. Like I think that there's something so innate about that inner voice. You kind of yeah. For me, I think first up is that inner voice and understanding that emotions are just one piece of data. How you feel in a role is only part of your decision making. It's also, again, that internal and external. Green flags are, I think, longevity. So, if there's a lot of staff turnover, that's probably something that means, maybe that's a bit of a red flag, I think, for me. I think not feeling psychologically safe and being able to express yourself. Like, I always want to know that I can ask stupid questions, and I do. I ask lots of them, and I'm not ashamed, like, of asking those questions. That's another big red or green flag for me. Yeah, I think they probably, I'm conscious of time, but I could keep talking, but they're probably some of the big ones for me.
Thank you, Zoe. Well, there is one relevant question that is for Brooke. Particularly when you are talking about the rejections in your slides, well, how does one build the capacity to be comfortable with that much rejection? That one was for Brooke.
I think it just comes with time. I think I just completely echo what Tess said, is that, you've got to really celebrate the wins and celebrate them hard. And you've got to feel the losses, but then kind of feel them and move on. And I think you become hardened to some of the losses a little bit, but there's some that definitely sting more than others. And that I've genuinely felt like completely sad about. And I don't think that will ever change, but I think it means that I love what I'm doing and I'm invested in what I'm doing. And I think, yeah, it just kind of, like Tess said, it fuels you. But for some people, it's, they might not be comfortable with that. So I think you have to kind of weigh up and, you know who you are and what you're comfortable with and what you're, how many are you really willing to get kicked down. But I think they do come, the wins do come too. And if you have that kind of idea in the back of your mind, it helps.
Yeah, that sounds like a very good strategy for the resilience. Well, the next question I maybe release to all three of you. Well, how have you learned to say no to opportunities, and how do you manage the fear of missing out on something important?
I mean, I would still like to, I think I'm still learning that one. I probably got to be better at saying no. But I mean, I think in terms of like, FOMO and things like that, is that, well, at least, if someone's asking you to do these things, like often opportunities will still arise. And it is always like a bit of a cost benefit analysis of, is that time or, commitment going to lead to something better? Or is it something that aligns with you personally as well? It doesn't always actually have to be about a metric and success, despite what I just talked about. It's got to be like, is it going to, fulfill you in multiple ways? And so then, there hasn't been yet to date something that I've turned down that then I've been like, oh no, that was a big mistake, or I'm really worried about that, because I've always found other things to fill that gap. What about yourself, Zoe and Brooke? Have you had similar experiences?
Absolutely. I think also I'm learning to. So it doesn't have to, I think there's so many opportunities where it's like, actually, no, right now, but if we planned for this, I'd like to keep the door open. So I'm, trying to, play both sides of the yes and no game there. Brooke?
Yeah, I mean, I'm conscious of time, but I'll just say that now I sit with something, the email, for like at least a day before I'd be like, yep, I'll do it. And now I'm like, no, I'm going to sit with that. I'm going to sleep on it. I'm going to get back to it. And I think that has actually been really helpful because it makes me think like, is this something I really want to put time into? What's the benefit for me? What are the benefits for others if I say yes or I say no? No. So I think, just not having I think having that gut reaction to say yes and have to do it all.
Yeah, all right. Thank you. Thank you, Brooke and Tess and Zoe for your fantastic response. Well, starting with the inspection, it's always a good one. I believe. All right. I might ask for the last question, considering the time. And sometimes co-workers and others can feel insecure and they don't offer opportunities. And how, as women, can we overcome this in modern workplace? Do we just ignore it, or is that the only solution? Tess, maybe you want to start with that one?
Yeah, no, I mean it's a great question, and I think that it's always a shame when things like that happen in terms of, and I guess like that if you're encountering that, I would definitely try and seek to speak to senior leadership and talk about having like institutional changes that allow opportunities and collaboration, and think about like say at our institute we run like grants clubs and paper clubs and stuff, so it's like people are aware of all the opportunities, and we spend we're really deliberate about trying to match expertise and give people opportunities, and sort of also then take that a little bit like empower that at a broader level, so it's not as reliant on that, but also sometimes that's just hard. People are people, and it can be difficult, but I then think trying to set the example as yourself, so be the change you want to see, that be open, give the next generation those opportunities, but then yes, try and lean on the more senior people to make a broader change.
Yeah.
I,
Awesome.
I'm just going to follow up that really, really quickly and say also, I agree with Tess, but also part of it is as ECRs, we need to understand the priority setting of our leadership. And don't be afraid to go up. If you are getting passed over for an opportunity, if somebody else is getting something that you wanted, don't go and, rant to your friends about it. That's totally fine. But also when you're ready, deep breath, and I do this myself, and I go to the leadership and go, please explain, like this is not a criticism, it's a please explain your priorities for that decision and how I can better suit my skills and how I can better be aligned to because we are part of an organization that has its own agenda and its own direction. So how do we as ECRs and EMCRs understand that vision so that we can align with it and grow with the organization?
I agree with all the points. And I just think that we just want to build each other up, don't we? And I think, like Tess said, like there's nothing better than to build up other people. So, if it's not happening in one direction, I think you just want to, surround yourself with people who are doing it and do it as well, because there's nothing more rewarding than seeing other people succeed as well.
Thank you so much for saying that, Brooke. Well, it's good to hear that as the last sentence of this session. It's always good to surround by supporting people around us. Well, all right. We might wrap up here. A big thank you again to all three of our speakers for sharing your time, experience, and insight so generously. And thank you to everyone who joined us today.